Welcome, future healthcare heroes. Ready for a rapid-fire test on blood disorders game? Let's conquer the bloodstream. Which vitamin is essential for proper blood clotting? A. Vitamin A. B. Vitamin B12. C. Vitamin C. D. Vitamin K.
The answer is vitamin K. If you're low on vitamin K, your liver can't make the necessary clotting factors. K stands for coagulation.
What is the term for a high platelet count? A. Thrombocytopenia. B. Thrombocytosis. C. Leukocytosis. D. Erythrocytosis.
The answer is thrombocytosis, thromboclot plus cytosis. To many cells, this raises the risk of dangerous, unwanted blood clots.
Which test is commonly used to evaluate blood clotting time? A. Complete blood count. CBC. B. Prothrombin time. PT. C. Hemoglobin A1C. D. Blood urea nitrogen. BUN.
The answer is prothrombin time PT. The PT test is used to measure how long it takes a plasma sample to clot after adding tissue factor.
What is the primary cause of sickle cell anemia? A. Iron deficiency. B. Vitamin B12 deficiency. C. Genetic mutation. D. Bone marrow failure.
The answer is genetic mutation. A single genetic change causes the red blood cells to deform into a rigid sickle or crescent shape.
Which blood disorder results from a deficiency of clotting factor VIII?
The answer is hemophilia. This is the classic genetic bleeder's disease because that factor VIII is missing, making it difficult to stop bleeding.
What is the term for a decrease in all types of blood cells? A. Anemia. B. Leukopenia. C. Pancytopenia. D. Thrombocytopenia.
The answer is pancytopenia. Pan means all, and penia means low. It's when the bone marrow is failing, causing low red cells, low white cells, and low platelets.
Which organ is primarily responsible for filtering old or damaged red blood cells? A. Liver. B. Kidney. C. Spleen. D. Bone marrow.
The answer is the spleen. Think of the spleen as the quality control department. It filters out the old, worn out, or poorly formed red blood cells.
What is the primary function of lymphocytes? A. Clot blood. B. Produce antibodies. C. Transport oxygen. D. Digest pathogens.
The answer is produce antibodies. These guys are the snipers of the immune system, generating targeted defense proteins against specific pathogens.
Which condition is characterized by the bone marrow's inability to produce blood cells? A. Hemolytic anemia. B. Aplastic anemia. C. Iron deficiency anemia. D. Pernicious anemia.
The answer is aplastic anemia. The A means without the bone marrow, the blood factory is wiped out and cannot produce enough new cells.
What is the term for the production of blood cells? A. Hemostasis. B. Hematopoiesis. C. Hemolysis. D. Hematuria.
The name says it all. Hema means blood, and poiesis means to make. It's the entire factory that makes all your components.
Which test measures the average size of red blood cells? A. Hematocrit. B. The mean corpuscular volume, MCV. C. The platelet count. D. White blood cell count.
The answer is mean corpuscular volume, MCV. The MCV is vital because it helps classify anemia. Are the cells too small, microcytic? Or too large, macrocytic?
What is the primary cause of thalassemia? A. Iron deficiency. B. Vitamin B12 deficiency. C. Genetic mutation. D. Autoimmune response.
The answer is genetic mutation. Thalassemia is an inherited disorder that affects the production of hemoglobin, leading to fragile and few red blood cells.
Which condition is characterized by excessive iron accumulation in the body? A. Anemia. B. Hemochromatosis. C. Leukemia. D. Thalassemia.
The answer is hemochromatosis. The body absorbs too much iron, which then builds up in organs like the liver and heart, causing serious damage. It actually causes skin color changes. Deposits of iron in skin cells can make the skin appear bronze or gray in color.
What is the primary treatment for hemophilia? A. Iron supplements. B. Vitamin B12 injections. C. Clotting factor replacement. D. Chemotherapy.
The answer is clotting factor replacement. Since the factor is missing, the treatment is simple: give the patient the factor they need.
Which blood disorder is associated with the presence of Reed-Sternberg cells? A. Non-Hodgkin lymphoma. B. Hodgkin lymphoma. C. Leukemia. D. Multiple myeloma.
The answer is Hodgkin lymphoma. Reed-Sternberg cells are large, abnormal lymphocytes found in biopsies of individuals with Hodgkin lymphoma. Common symptoms of Hodgkin lymphoma include painless, swollen lymph nodes in the neck, armpit, or groin.
What is the term for the destruction of red blood cells? A. Hematopoiesis. B. Hemostasis. C. Hemolysis. D. Hematuria.
The answer is hemolysis. This is what happens when you shake a blood tube too hard. You literally burst the red cells and ruin the sample.